Welcome back to the deep dive. Today we're plunging into a topic that can be incredibly common and frankly pretty heart-wrenching for anyone involved in equine breeding.
Absolutely.
We're talking about equine early embryonic death, or ED, in mares.
EED.
We've pulled together a whole stack of sources, research, practical insights from vets, and our mission for you today is really to equip you with the essential understanding.
It's crucial stuff.
We want you to grasp its complex causes,
Yeah.
how it's diagnosed meticulously, I should add, and the management strategies that can actually make a difference.
Because it really can.
Because, as we'll quickly see, ED is, well, it's a multifactorial puzzle, isn't it?
Yeah.
Often tricky to solve, but so important to understand.
It truly is. A multifaceted challenge, often leaving breeders looking for answers, searching for that missing piece.
So let's start with the basics then. When we talk about equine early embryonic deaths, what exactly are we defining? What's the time frame here?
Okay, so ED is defined as the loss of the conceptus, and that includes both the embryo itself and its surrounding membranes, before approximately day 40 of gestation in a mare.
Day 40.
Yeah.
Okay. And how common is this? Because it feels like it comes up a lot in breeding discussions.
Oh, it does. You're right. It's a significant concern. Reported rates range anywhere from, say, 5% up to maybe 23%, even in apparently healthy mares.
Wow, 23%.
Yeah. And what's particularly striking is that the vast majority of these losses happen before day 35, often very, very early on. And the interesting thing here is that ED is, well, fundamentally similar to conception failure in its outcome, right? The mare isn't pregnant.
Right.
But it's specifically about a loss after conception has already happened. It primarily impacts the mare's reproductive system, and often, like you said, it happens silently. The first sign is just the mare coming back into heat.
That makes perfect sense. Okay, now you mentioned it's complex, a puzzle. Why does these happen? What's this intricate web of causes we need to unravel?
Well, the causes are indeed often multifactorial, and unfortunately, sometimes they just remain undiagnosed, even after a lot of investigation. But we broadly categorize them into, issues starting with the embryo itself, intrinsic factors.
Okay.
Then factors related to the mare, extrinsic factors related to her body, and then some external influences, too.
Okay, let's start right at the beginning then, with the embryo. What kind of intrinsic issues, things from the embryo itself, can cause a pregnancy to fail so early?
Right. So a really significant cause, estimated to be responsible for maybe 20% of losses, are chromosomal abnormalities.
20%, that's quite high.
It is. These are genetic defects that can just arise spontaneously during the formation of the gametes. So the mare's oocyte or the stallion's sperm, or even during the very first cell divisions of the embryo. The key insight here, I think, is that even with perfect management, a big chunk of ED cases are down to this sort of genetic roll of the dice right at the start. It's a stark reminder that some things are just, well, beyond our control.
That 20% figure, does that mean breeders are always playing a bit of a genetic lottery? Is there any way to screen for that? Or is it just part of the risk?
It absolutely highlights that unpredictability.
Yeah.
I mean, while some severe chromosomal issues might be inherited, many are just spontaneous errors in cell division.
Right.
And currently, there's no routine, widely available way to screen for these specific embryonic chromosomal problems before implantation in horses. So that 20% often stays a mystery loss.
Okay. What else on the embryo side?
Well, poor oocyte quality is another big one, especially common in older mares. It just leads to reduced ability for the embryo to develop properly.
Makes sense.
And of course, sperm quality matters too. Abnormalities there can also lead to non-viable embryos. And finally, delayed fertilization.
Meaning
Insemination happens quite a bit after ovulation. This results in an aged oocyte, which just has a higher chance of leading to ED. Its viability window has kind of passed.
Okay, so we've looked at the embryo side. Lots can go wrong right from the start, but often the mare herself, her body, plays a huge role, doesn't she? Let's shift to those maternal factors.
You've hit on a critical point there.
Yep.
Yes. When we look at maternal factors, the uterine environment is, well, it's by far the most common and impactful area.
Okay.
So, for instance, endometritis, that's inflammation or infection of the uterine lining, the endometrium,
Right.
that can directly harm the embryo, or maybe more subtly, it can trigger the release of prostaglandin F2, PGF2.
And what does that do?
That chemical causes luteolysis, basically the regression of the corpus luteum, or CL.
The CL that produces the progesterone, right, the pregnancy hormones.
Exactly. So think of PGF2 as a stop pregnancy signal. It directly cuts off that vital progesterone supply from the CL, which is absolutely essential to maintain the pregnancy.
Wow. It sounds like a really devastating chain reaction, just cutting off the lifeline.
Yeah.
What else in the uterine environment can be a problem?
It can be, yeah. Also, endometrial cysts. These are essentially dilated lymphatic vessels in the uterine lining.
Okay.
If they're large, or if there are many of them, they can physically get in the way of embryo mobility.
Mobility. Why is that important?
Well, the early embryo has to move around the uterus quite a bit. That movement is crucial for signaling to the mare's body that she's pregnant. It's part of maternal recognition.
Oh, okay.
So cysts can interfere with that signaling, or they can just reduce the surface area available for the placenta to form properly later on.
Leading to poor nutrient exchange.
Exactly. Inadequate nutrient exchange and ultimately a struggling or lost embryo. And in older mares, we often see something called endometrial degeneration or fibrosis. This is where you get chronic inflammatory changes or actual scarring of the uterine lining.
Okay.
This can impair the uterus's ability to produce what's called uterine milk or histotroph. That's essential for feeding the embryo early on. It also compromises blood flow.
So the environment just isn't supportive.
Right. And then there's uterine fluid accumulation after breeding. You see this particularly in what we call problem mares. It's a strong sign of endometritis and creates a hostile, unwelcoming environment.
So it's not just infection, but actual structural and functional issues in the uterus.
Okay.
Starving or suffocating the embryo, essentially. What about hormones? We mentioned progesterone.
Absolutely. The primary corpus luteum, the CL, produces that progesterone, the cornerstone for maintaining pregnancy. Now, while truly primary luteal insufficiency, where the CL just doesn't produce enough from the get-go, is thought to be less common,
Okay.
progesterone levels can drop prematurely for other reasons. Often, it's because of that endometritis-induced PGF2 release we talked about, causing premature luteolysis.
Right, the stop pregnancy signal again.
Exactly. Another critical time is if the embryo fails to signal its presence adequately for maternal recognition of pregnancy. This usually needs to happen by day 14-16.
That movement signal you mentioned.
Partly, yes. It's a complex biochemical signal, too. But basically, the embryo tells the mare's body, hey, I'm here, don't return to estrus.
And if that signal fails?
Then the mare's uterus releases PGF2, causing luteolysis, and she cycles back. And interestingly, severe stress,
Like what?
things like colic, laminitis, stressful transport, any systemic illness or significant pain, these can also induce premature luteolysis through PGF2 release.
So even just a mare getting really stressed on a long trailer ride could potentially trigger a loss.
Wow. It really shows how incredibly delicate these early stages are, doesn't it?
It really does. Makes you want to wrap them in cotton wool sometimes.
Oh, yeah. So beyond the uterus and hormones, are there other big maternal factors?
Yes, definitely. Maternal age is a big one. Mares in their late teens and older, specifically over 15 years, they have a significantly higher incidence of E.
Why is that?
It's often a double whammy for older mares. Not only is their oocyte quality often declining with age, but their uterine environment might also be deteriorating due to fibrosis or other issues. It makes the challenge much harder.
Okay, what else?
Poor reproductive conformation. Things like pneumovagina windsucking or urine pooling in the vagina can lead to chronic uterine contamination and endometritis.
Right, structural issues leading to infection. Exactly. And any severe systemic illness, pain, or even environmental stress like extreme heat during early pregnancy increases the risk too. Nutrition is also key. Severe deficiencies of certain vitamins like vitamin A or trace minerals, copper, zinc, iodine can impair embryo viability. And we also need to watch out for environmental toxins, things like mycotoxins in contaminated feed or toxic plants. Endophyte-infected fescue is a classic one, or ergotized grasses and greens.
Okay. Any pre-existing conditions?
Yes. PPID, pituitary pars, intermediate dysfunction, Cushing's basically, and MSR, equine metabolic syndrome or insulin resistance, severe laminitis too. These all put general physiological stress on the mare, impacting pregnancy. Other things to consider. Factors related to advanced reproductive tech, like transferring embryos from older mares or using IVF. These embryos might have subtle issues.
Right.
Even some heterospecific matings, like a stallion to a jenny, have higher risk due to biological incompatibilities. Full heat breeding is sometimes mentioned, though it's a bit controversial. The evidence is mixed. And finally, just a mare's individual susceptibility to that post-mating induced endometritis, PMIE. If she's prone to that inflammatory response after breeding, it needs rigorous management.
That is an incredibly comprehensive list of things within the mare herself. It's clear how much can impact things maternally. What about external factors, things not tied to her physiology?
Well, the most prominent external factor, and one that's entirely preventable with good management, is twinning.
Ah, yes, twins.
The mare's uterus just isn't designed to carry twins successfully to term. If twin pregnancies aren't found and managed very early on, they almost invariably result in the loss of both embryos, or maybe a late-term abortion. It's devastating either way.
Right, a classic example needing sharp eyes. So with all these potential causes, embryonic, maternal, external limbs,
Yeah.
how do vets actually figure out what's going on? What's the detective work involved in diagnosing EAD? Because it sounds like it's often found out after the fact.
You're absolutely right. It's frequently diagnosed retrospectively when the mare cycles back. However, active proactive monitoring is really key to catching impending losses, or recent ones, allowing for better management.
And the main tool for that is?
Routine transrectal ultrasonography. Ultrasound. It's the absolute bedrock of the diagnostic process here, and the timing of these ultrasound checks is very specific and really crucial. The first pregnancy check is typically done around day 14 to 16 post-ovulation.
Okay.
This is critical not just for confirming she is pregnant, but even more importantly for identifying and managing any twin pregnancies before they fixate and become a major problem.
Right, dealing with twins early.
Exactly. Then there's usually a second check around day 25 to 30. The main goal here is to confirm the presence of a heartbeat. That's a definitive indicator of embryonic viability at that stage.
A key milestone.
A very key milestone. Then a third check, often around day 40 to 45. This is important because this time frame is often considered the sort of traditional end of the early embryonic death period. After this, we tend to talk about fetal loss. Okay. This check is also vital because after around day 40-45, these specialized fetal cells called endometrial cups form in the mare's uterus.
Ah, the cups. You mentioned those.
Yes. They start secreting a hormone called equine chorionic gonadotropin, or ECG. These cups are basically the pregnancy's long-term hormonal signal. Once they're established, they keep the mare's body thinking she's pregnant for months, even if the embryo or fetus is lost.
So if she loses it after the cups form?
Then she often won't return to estrus for several months, making rebreeding in the same season very difficult, often impossible. That day 40-45 check is critical for future breeding plans.
So for a vet, this is really where the deep dive into diagnostics happens, isn't it? Looking closely at that ultrasound, what specific things are they looking for that might signal an impending ED? Those subtle clues.
Precisely. Vets are looking for several signs, some subtle, some not so subtle, that indicate trouble. One is an abnormal vesicle appearance. The embryonic vesicle might look irregular in shape, not perfectly round, or the fluid inside might look granular or speckled instead of clear and black.
Okay.
Another red flag is if the embryo or the whole vesicle is significantly smaller than expected for its gestational age, just not growing right.
Right.
Continued embryo mobility after day 16 is also a serious concern. Normally, the vesicle should become fixed in one spot in the uterus by then. If it's still floating around after day 16, something's likely wrong. We also look carefully for any uterine fluid accumulation. Free fluid seen around the conceptus often suggests underlying endometritis, that hostile environment we talked about. Decreased conceptual fluid volume within the vesicle itself can be another sign. And of course, the absence of a heartbeat, if one should be visible by day 28-30, that's pretty definitive.
Yeah.
Also, any signs of disruption of the conceptual membranes or significant edema swelling of the endometrial folds around the vesicle, that can also point towards endometritis. Critical red flags.
Ultrasound is clearly the main tool. What else might indicate a problem besides the images?
Well, the most common indicator, as we said, is simply when a mare you thought was pregnant returns to estrus, usually around her normal 21-day cycle, maybe a bit later.
The most obvious sign, really.
Often, yes. Blood tests for progesterone levels can also give clues. Now, a single low value isn't definitive proof of ED,
Okay.
but a persistently low level, or one that's clearly declining over time, can indicate luteal insufficiency or that impending luteolysis. Interpreting these gets trickier later in gestation because the placenta starts making progesterone too, so it's usually used alongside other findings. Later on, say day 45 to 60, just doing a manual rectal palpation. If the vet can't feel the expected uterine bulge or the cervix and uterus don't have that characteristic pregnant tone, that strongly suggests the pregnancy has been lost.
Right.
And when diagnosing, vets always consider other possibilities, differential diagnoses. Could it have been conception failure in the first place? Was the initial pregnancy diagnosis maybe mistaken? Or is the embryo just still migrating normally before fixation at day 16?
Good.
For more complex cases, you might do more extensive diagnostics. A complete blood count, biochemistry, urinalysis to check for inflammation, a vaginal speculum exam, or even hysteroscopy to look inside for structural issues.
Like cysts or scarring.
Exactly. Endometrial cytology, culture, and biopsy are crucial for assessing inflammation or fibrosis in the lining. And sometimes you might even analyze feed or the environment for toxins, or do cytogenetic studies for those chromosomal abnormalities if it's recurrent ED.
It's incredibly thorough detective work, piecing it all together. Okay, now for the tough part. Once an embryo is definitively diagnosed as non-viable, sadly, there's no way to save it at that point.
Unfortunately, no.
So what then? What are the proactive steps and the management strategies after ED is confirmed, or even better, to try and prevent it?
You're exactly right. At that point, the focus shifts completely. It becomes about identifying the underlying cause, if we can, and then preparing the mare for the next breeding attempt, ideally in the same season if possible. So proactive and preventative measures are absolutely critical.
Where do you start with prevention?
First and foremost is a breeding soundness examination, or BSE. Highly recommended for all mares, but especially older ones or those with a history of problems.
What does that involve?
It's a really comprehensive checkup. Includes a thorough reproductive history, transrectal palpation and ultrasound, a vaginal speculum exam, uterine culture, cytology, and very importantly, an endometrial biopsy.
Why the biopsy?
The biopsy assesses the health of the uterine lining, directly looking for inflammation, fibrosis, glandular changes. The critical insight here is that correcting problems found during the BSE before breeding.
Right.
Things like treating endometritis, surgically repairing poor perineal conformation, maybe doing a Caslix procedure for pneumovagina, or managing significant endometrial cysts. Doing that before she's bred can significantly improve pregnancy rates and drastically reduce the ED risk.
So laying that meticulous groundwork before conception is absolutely key. Makes sense. What about optimizing the actual breeding process when she's ready?
Absolutely critical. Optimizing breeding management involves precise timing of insemination. You really want to breed as close to ovulation as possible
Why is that so important?
to ensure you have fresh, viable gametes, both sperm and oocyte. It avoids that increased ED risk that comes with delayed insemination and an aged oocyte.
Got it.
Using good quality semen with good, clean insemination technique is also vital. And strict hygiene during breeding, whether it's natural cover or AI, is just non-negotiable to minimize uterine contamination. Now, for those problem mares that are known to be susceptible to post-breeding induced endometritis, PMIE,
Yes.
minimizing this inflammation is crucial. That often means aiming for a single insemination per cycle if possible, and implementing aggressive post-breeding uterine lavage, usually 4 to 6 hours after breeding.
Flushing the uterus out.
Exactly. Flushing out inflammatory debris and excess semen. This is often combined with giving oxytocin right after breeding to help the uterus contract and clear itself.
What about antibiotics in the uterus?
The routine use of intrauterine antibiotics is actually quite debated. And systemic antibiotics, given by injection or orally, are generally considered ineffective for preventing ED caused by simple endometritis. Lavage and oxytocin are usually the mainstays.
Okay. And what about that external factor we discussed, twinning, given how devastating it can be?
Twin management isn't just recommended, it's pretty much mandatory for responsible breeding. Early twin reduction, manually crushing one of the embryonic vesicles, needs to be done at that day 14-16 first pregnancy check.
Before they get too established.
Precisely. This intervention dramatically improves the chance of carrying a viable singleton pregnancy to term. You're essentially saving one foal instead of almost certainly losing both. Now let's touch on progestogen supplementation. Things like oral altrenogist Regumate or injectable progesterone in oil.
Right, the hormone support.
Yes. What's often misunderstood here is that using it routinely on every mare is quite controversial.
Wow. Well, is that?
Because most mares actually produce perfectly sufficient progesterone on their own. Supplementing unnecessarily doesn't help and just adds cost and effort.
So when is it indicated?
There are specific situations. Mares with a documented history of repeated ED where low progesterone, luteal insufficiency, is strongly suspected, or mares showing subtle signs of trying to return to estrus despite having a confirmed, apparently normal early pregnancy.
Okay.
Also, mares undergoing severe stress or illness like colic or laminitis in early gestation might benefit, or those with repeatedly documented low or declining peripheral progesterone levels, although, again, interpreting those blood levels needs care.
So it's definitely not a universal fix. It's a targeted treatment. If it's used, what's the typical plan? And are there downsides?
Right. If indicated, supplementation often starts right after ovulation or maybe after the first pregnancy confirmation around day 14. It typically continues until about day 75 to 100 of gestation.
Why that long?
By that stage, the placenta has fully taken over progesterone production, so the CL support isn't needed anymore. It's generally recommended to taper the dose off slowly, maybe over 14 days, at the end of treatment, rather than stopping abruptly.
Okay. And the caveats, the
A
downsides.
key caveat, and this is crucial for breeders to understand, progestogen supplementation will prevent a mare from returning to estrus if she does lose the pregnancy while on the medication.
Oh, so you might not know she lost it.
Exactly. It masks the loss, potentially delaying rebreeding efforts significantly, maybe losing the whole season. So continued pregnancy checks via ultrasound are absolutely essential, even if she's on supplementation. You can't assume everything's fine just because she's not showing heat.
That's a really important point.
It is, and it's also contraindicated, shouldn't be used if there's an active uterine infection present, because progesterone can suppress the mare's natural immune responses and uterine clearance mechanisms.
Got it. What's the dose for something like Altrenagist?
The specific dosage is typically 0.044 to 0.088 milligrams per kilogram of body weight, given orally once daily.
Okay. And finally, what about environmental management? Can things like the mare's living situation or routine really make a difference?
They really can have a surprisingly significant impact, especially on stress levels. Minimizing stress from things like transportation, sudden changes in routine, or introducing new aggressive herd mates is important.
Right. Keep things calm.
Exactly. Ensuring adequate, balanced nutrition is fundamental. And avoiding extreme environmental temperatures, particularly heat stress, which can definitely impact early pregnancy. For mares normally in competition, restricting strenuous activity might also be necessary to reduce physical and mental stress.
Okay. So if we connect this all back,
Yeah.
once ED is confirmed, unfortunately,
Huh.
what happens next for that mare? What's the management plan after the loss?
Right. Once ED is confirmed, the immediate next step is to try and determine the cause, if possible. Like we said, it's often hard to pinpoint definitively. But the timing of the loss, the mare's history, any diagnostic findings, they can all provide valuable clues. These clues then inform how you manage her future breeding attempts. Think of it like doing a post-mortem on the pregnancy to create a better plan for the mare going forward.
Learning from the loss.
Precisely. Then the next step is to ensure the uterus clears properly. Now, if the ED happens before those endometrial cups form, generally before day 35-40,
Yes.
the mare will typically just return to estrus on her own schedule and naturally clear out any remaining uterine contents. Her body resets itself.
But if it happens after the cups form,
That's different. If the loss occurs after cup formation, say, from day 40, 45 up to maybe day 120, those endometrial cups will keep producing ECG. They'll keep the secondary CLs active, and that prevents the mare from returning to estrus for potentially several months.
locking her in a pseudo-pregnant state.
Exactly. In these cases, we can administer PGF2, the same hormone that can cause loss, to lyse those CLs and basically tell the body the pregnancy is over. This accelerates uterine involution, allows her to return to normal cyclicity, and crucially, it might allow her to be rebred in the same season.
Which is a huge deal for breeders.
A huge economic and logistical advantage, yes. After any ED, it's generally recommended to reassess the mare with a full breeding soundness exam, especially if it's a case of recurrent ED, to try and identify any underlying issues that might have been missed or developed.
Oh, okay.
And this then leads into strategic rebreeding. If the loss happens early in the season and you can intervene quickly, like with PGF2 if needed, you might get another chance that year. Breeding strategies should then be adjusted based on the suspected cause, for instance, maybe more intensive post-breeding management if endometritis was suspected.
This has been such a thorough deep dive and just so crucial for breeders navigating these really tough situations. What's the road ahead look like for a mare after she's experienced ED? What's a general prognosis for future pregnancies?
Yeah, that's the big question, isn't it? The prognosis for a subsequent successful pregnancy really depends heavily on the underlying cause that led to the ED in the first place.
Makes sense.
If the cause was likely an isolated event, maybe a twin pregnancy that was successfully reduced, or a temporary period of severe stress that's now resolved, or perhaps a mild endometritis that was treated effectively, then the prognosis is generally quite good.
Okay.
Many of those mares will go on to conceive again and carry a healthy foal to term in subsequent breedings.
That's encouraging. But what about the tougher cases?
Right. The prognosis becomes more guarded for mares with chronic, potentially untreatable uterine problems, things like severe endometrial fibrosis, that's scarring or large inoperable cysts, or for mares that have repeated ED despite really intensive interventions and management.
Hmm.
And here's where that age factor comes back in strongly. Older mares, particularly those over 15, generally have a more guarded prognosis overall. It's due to that combination of potentially declining oocyte quality and age-related uterine changes, the tougher hill to climb.
And does the timing of the loss affect the immediate future?
Yes, significantly, especially for the current breeding season. Losses that happen before endometrial cup formation, before that day 40-45 mark,
Yeah.
usually allow for earlier rebreeding.
Yeah.
So the prognosis for getting a successful pregnancy in that same season is generally better.
Right.
Losses after the cups form often mean missing that breeding season entirely, which has obvious implications for the breeder.
So it really hammers home that meticulous management, diligent veterinary oversight, and crucially, the timing of diagnosis and intervention can literally make or break a breeding season.
Absolutely, it's critical.
So wrapping this up, what are some of the absolute key insights, the main takeaways we hope our listener walks away with from this deep dive?
I think a critical point is truly understanding the aged mare's increased susceptibility to EAD and sometimes her refractoriness to treatment. It's a difficult reality for owners, but important to grasp. Also, recognizing that heightened susceptibility in mares with those pre-existing systemic diseases, PPID, MSIR, their overall health deeply impacts reproductive success.
It's all connected.
It really is. Understanding the nuances of endometritis, knowing about the seasonal aspects of breeding, paying attention to specific nutritional requirements, and not overlooking the role of environmental factors like that endophyte-infected fescue or the complexities of certain breedings. It's all vital for proactive management. It's about seeing the whole interconnected picture.
Wow, what a journey through the real complexities of equine early embryonic death. It is truly a multifactorial challenge, isn't it?
Right.
But understanding these intricacies, as we've hopefully helped do today, can make such a profound difference in a mare's reproductive future and ultimately a breeder's success. This deep dive really shows that knowledge is power in the breeding shed.
Indeed, it does. We really hope this deep dive provides you, the listener, with valuable knowledge and empowers you with the insights you need for more proactive, informed management. That's really essential for breeding success.
Absolutely. And it leaves me thinking, considering how absolutely critical the timing of diagnosis is for a mare's rebreeding potential that season, what might be the next frontier? Could there be earlier, maybe less invasive detection methods on the horizon that could give breeders even more strategic options, maybe even before that day 14 scan? Something to ponder. Thank you for diving deep with us today.